7 signals your heart sends long before a crisis, and almost nobody notices them right now. Before you do anything else, take one slow, deep breath. No rush. Just breathe in and pay attention to how it feels. Easy and open, or slightly more effortful than it used to be? That simple question matters more than you might think. Because in the next few minutes, I am going to walk you through 7 specific signals that the heart begins sending, often years before a heart attack or a formal diagnosis of heart failure ever occurs. Signals that people almost always explain away with something else entirely. Fatigue gets blamed on poor sleep. Breathlessness gets blamed on being out of shape. Swelling gets blamed on standing too long. Heart failure rarely begins with a dramatic moment. Almost always it begins quietly, with a gradual decline in efficiency, with barely noticeable changes that build over months and years before they ever become a genuine crisis. My name is Dr. Richard Whitfield. For more than 27 years I have worked in internal medicine, focused specifically on adults managing cardiovascular health after the age of 60. And what I observe again and again genuinely concerns me. By the time heart failure receives a formal diagnosis, the warning signs had often been present and dismissed for a year or more. That ends today. Leave your age in the comments and tell me, have you noticed any of these changes over the last 12 months? I read every comment, and your answers shape exactly what I cover next. Stay with me through all 7, because sign number 5 is the one that, in my clinical experience, is most consistently overlooked and has led to the greatest number of missed early diagnoses. Why the heart sends these particular signals. The heart's job is straightforward to describe and extraordinarily complex to perform. Pump oxygen-rich blood efficiently to every cell in the body and return the depleted blood efficiently back to the lungs. When the heart muscle weakens, even modestly, it begins to compensate. It works harder. It pumps less blood per beat. Blood begins to back up. Fluid begins to shift. Oxygen delivery to the tissues becomes slightly less reliable. None of this happens all at once. It happens gradually, and the body adapts to each small decline. That is precisely why the early signs are so easy to miss. You do not notice a sudden change. You notice that familiar things feel slightly harder than they used to. And slowly, slightly harder becomes the new normal, without you ever registering exactly when that shift took place. Sign 1. Breathlessness with activities that used to be effortless. This is one of the earliest and most reliable signs of heart failure, and one of the most frequently attributed to simply being out of shape or getting older. A flight of stairs that used to present no difficulty. Grocery bags from the car that used to feel light. A walking pace that used to feel comfortable, now leaving you noticeably short of breath. When the heart is not pumping efficiently, blood can back up into the vessels of the lungs, making it harder for the lungs to expand fully and exchange oxygen properly. The result is breathlessness at activity levels that previously caused no difficulty whatsoever. A study published in the Journal of the American College of Cardiology found that new breathlessness on exertion was present in more than 80% of patients later diagnosed with heart failure, frequently 6 months to over a year before formal diagnosis. If activities that used to feel easy have become noticeably more demanding over the last year, that change itself, regardless of how gradual it has been, is meaningful information. Sign 2. Swelling in the ankles, feet, or legs. When the heart is not pumping efficiently, fluid can accumulate in the venous system and leak into the surrounding tissue, most commonly in the lowest parts of the body due to gravity. The test is simple. Press firmly into the skin near your ankle for 5 seconds, then release. If a small indentation remains and takes several seconds to disappear, that is called pitting edema, and it is one of the most clinically significant signs of fluid retention related to heart function. This swelling typically worsens toward the end of the day after prolonged standing or sitting and may improve somewhat overnight when the legs are in a horizontal position. Research has shown that bilateral ankle swelling, present in both legs simultaneously, was one of the most consistently reported early signs in patients who were eventually diagnosed with heart failure. If this swelling has become a regular pattern over recent months, mention it specifically and clearly at your next medical appointment. Sign 3. persistent fatigue that is disproportionate to your activity level. This fatigue is different from ordinary tiredness. It is present even after adequate sleep. It develops with relatively light exertion, and it tends to worsen gradually rather than appearing suddenly. The mechanism is direct. When the heart cannot pump blood efficiently, the muscles and tissues receive less oxygen-rich blood than they require. Even during everyday activities, the body experiences that oxygen shortfall as fatigue, regardless of how much rest you have had. A study published in the journal Circulation found that unusual fatigue was reported by nearly 70% of patients in the months leading up to a heart failure diagnosis, and was frequently dismissed initially as simply getting older. If fatigue has become disproportionate to your actual activity level and rest is not resolving it, this deserves direct attention rather than continued explanation as a normal feature of aging. Sign 4. Difficulty breathing while lying flat, needing extra pillows to sleep comfortably. This specific sign has a name in medicine: orthopnea. When you lie flat, fluid that has been accumulating in the lower body during the day redistributes back toward the chest and lungs. If the heart is not managing fluid balance effectively, that redistribution can cause genuine breathing discomfort in the horizontal position, discomfort that improves when you sit up or prop yourself with additional pillows. Many people gradually add more pillows over the course of months without ever consciously connecting that pattern to a cardiovascular cause. It simply becomes their new normal sleeping position. If you have found yourself needing progressively more pillows to breathe comfortably while lying down, or have begun sleeping in a reclined rather than flat position, this is a specific and clinically significant sign that deserves a direct conversation with your physician. Sign 5. The one almost everyone ignores: a persistent dry cough, particularly one that worsens when lying down, with no cold, flu, or allergy explanation. Here is why this sign is so consistently overlooked. A cough seems like a respiratory issue, not a cardiac one. People assume allergies, a lingering cold, or simply dry air, and almost never connect it to heart function at all. But when fluid backs up into the lungs due to reduced cardiac efficiency, it can irritate the lung tissue and airways, producing a persistent, typically dry cough with no infectious or allergic cause. This cough frequently worsens specifically in the horizontal position for the same fluid redistribution reason described with orthopnea, and may improve somewhat when sitting upright. A study published in the European Journal of Heart Failure found that an unexplained chronic cough was present in a notable proportion of heart failure patients in the months before diagnosis, and was the symptom most frequently attributed by patients themselves to an unrelated cause. If you have had a persistent dry cough for more than a few weeks with no clear respiratory explanation, particularly one that worsens when lying down, this deserves cardiac evaluation, not only a respiratory one. Sign 6. A noticeably elevated resting heart rate compared to your personal normal. When the heart is not pumping sufficient blood with each beat, it frequently compensates by beating more rapidly in order to maintain adequate blood flow. This means your resting heart rate, measured when you are completely at rest, may gradually increase over time, even without any change in your activity level or caffeine intake. If you monitor your heart rate through a wearable device or simply by checking your pulse manually, and you have noticed a sustained increase in your resting rate over recent months, that trend is worth noting and reporting specifically. This is different from a temporary increase due to stress, caffeine, or illness. This is a sustained shift in your baseline that persists across normal, calm, everyday conditions. Sign 7. Sudden weight gain over a short period without any change in diet. This may seem like an unusual heart-related sign, but it is one of the most clinically useful because it reflects fluid retention rather than fat accumulation, and it can develop rapidly. A weight gain of 1 to 1.5 kilograms or more within a single day, or 2 to 2.5 kilograms or more within a week, without any change in eating habits, is a sign that the body is retaining fluid, often related to declining cardiac efficiency. Many heart failure patients are specifically instructed to weigh themselves daily for exactly this reason, because rapid fluid-related weight gain is often the earliest detectable sign of an approaching decline, sometimes appearing before any other symptom becomes noticeable. If you have experienced sudden unexplained weight gain over a short period, this is a sign that deserves prompt medical attention rather than a dietary explanation. Bringing all 7 together: breathlessness with previously easy activities. The heart may not be pumping efficiently enough to meet oxygen demand. Swelling in the ankles and legs. Fluid may be backing up due to reduced cardiac output. Disproportionate fatigue. The tissues may be receiving less oxygen-rich blood than they need. Difficulty breathing while lying flat. Fluid redistribution may be affecting the lungs. A persistent unexplained dry cough. Fluid backup may be irritating the lung tissue. A rising resting heart rate. The heart may be compensating for reduced pumping efficiency. Sudden unexplained weight gain. The body may be retaining fluid rapidly. None of these signs in isolation confirms a diagnosis, but 2 or more together, especially if they have developed gradually over recent months, is a pattern that deserves a direct conversation with your doctor. Ask specifically about an echocardiogram, which evaluates how efficiently the heart is pumping, and a BNP blood test, which measures a hormone that rises specifically when the heart is under strain. Your heart does not announce its difficulties loudly. It compensates quietly, for as long as it possibly can. The only thing that was missing was someone telling you clearly what to watch for. Now you have that. If this conversation was useful to you, if even one of these signs caused you to think differently, then this video did exactly what it was created to do. Every week on this channel, we explore topics that help you better understand your own body, grounded in evidence-based medicine, explained in plain and honest language. Subscribe to the channel right now and make sure to tap the notification bell so you never miss a new video. Give this video a like and share it with someone who needs to hear this. One signal heard at the right moment can change a great deal. And in the next video, we will talk about what your liver has been quietly trying to tell you, and why these 2 organs work in an inseparable partnership. Do not miss it. See you in the next video.